Wearing personal protective equipment, washing your hands, and physical distancing are 3 easy ways you can keep yourself and the people around you healthy and safe. In this module, you will learn how to properly wear and maintain personal protective equipment, or PPE, such as masks, how to properly wash your hands, and how to physical distance. Let's get started. Section 1. How to wear and clean a mask. According to the U.S. Centers for Disease Control, COVID-19 spreads mainly from person to person through respiratory droplets produced when an infected person coughs, sneezes, or talks. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. Studies and evidence on infection control report that these droplets usually travel around 6 feet, about 2 arms lengths. Personal protective equipment such as masks, face coverings, or face shields may slow the spread of the virus and help people who may have the virus and do not know it from transmitting it to others. This is why UNO requires everyone on campus to wear a mask, face covering, or face shield while on campus, especially while indoors. While UNO has made available 2 masks for every student, staff, and faculty member, you can also purchase or make your own face coverings. A tutorial on how cloth face coverings can be made from household items is available on the CDC website. You may be wondering, how do I properly wear a mask or face covering? While many face coverings are different, there are some things that remain the same. UNO follows CDC guidance regarding face coverings, which we will walk you through now. First, wash your hands before putting on your face mask. Then, put it over your nose and mouth and secure it under your chin. Try to fit it snug against the sides of your face, and make sure you can breathe easily. While wearing a mask or face covering, be sure to keep it on your face the entire time, and avoid touching it as much as you can. If you do touch it, be sure to wash your hands. You can follow similar steps for face shields. And that's it. When it's time to take off and clean your mask or face covering, untie the strings behind your head or stretch the ear loops, handling them only by the ear loops or ties. Then fold the outside corners together and place the covering in the washing machine, being careful not to touch your eyes, nose, and mouth when removing. With your mouth or face covering in the washing machine, make sure to wash your hands immediately. Your approach to cleaning a face shield will be slightly different. Clean it with soap and water. If your face shield ever appears cracked or damaged, discard it and find a replacement. Section 2. How to properly wash your hands. We've been told for as long as we can remember that washing our hands is the best way to prevent ourselves from getting sick. This is especially true during the COVID-19 pandemic. Step 1. Wet your hands with clean, running water, warm or cold, turn off the tap, and apply soap. Step 2. Lather your hands by rubbing them together with the soap. Lather the backs of your hands, between your fingers, and under your nails. Step 3. Scrub your hands for at least 20 seconds. Need a timer? Hum the happy birthday song from beginning to end, twice. Step 4. Rinse your hands well under clean, running water. Step 5. Dry your hands using a clean towel. Washing your hands can keep you healthy and prevent the spread of respiratory and diarrheal infections from one person to the next. Germs can spread from other people or surfaces when you touch your eyes, nose, and mouth with unwashed hands, prepare or eat foods and drinks with unwashed hands, touch a contaminated surface or objects, blow your nose, cough, or sneeze into hands and then touch other people's hands or common objects. After you have been in a public place and touch an item or surface that may be frequently touched by other people, such as door handles, tables, gas pumps, shopping carts, or electronic cashier registers or screens. If you can't wash your hands with soap and water, the UNO facilities team has placed hand sanitizing stations throughout campus to help out in a pinch. Carrying your own bottle of hand sanitizer can also go a long way in keeping yourself healthy and safe. Be sure the hand sanitizer you use contains at least 60% alcohol. You can verify this by checking the product label. When using hand sanitizer, read the label at the hand sanitizing station or on your personal hand sanitizer To learn the correct amount, then apply the gel product to the palm of one hand. Rub your hands together, then rub the gel over all the surfaces of your hands and fingers until your hands are dry. This should take about 20 seconds. Section 3. How to physical distance. According to the CDC, limiting face-to-face contact with others is the best way to reduce the spread of coronavirus disease. Physical distancing, also called social distancing, means keeping space between yourself and other people outside of your home. The CDC also notes that COVID-19 spreads mainly among people who are in close contact for a prolonged period. And that spread happens when an infected person coughs, sneezes, or talks, and droplets from their mouth or nose are launched into the air and land in the mouths or noses of people nearby. The droplets can also be inhaled into the lungs. Because people can spread the virus before they know they are sick, it is important to stay away from others when possible, even if you or they have no symptoms. Physical distancing is especially important for people who are at higher risk for severe illness from COVID-19, which includes older adults and people with medical conditions. To practice physical distancing, the CDC says to stay at least 6 feet, or about 2 arms lengths, away from other people. When you physical distance, you aren't just keeping yourself healthy, you're keeping your community healthy too.